We're also getting some good news this morning about a potential vaccine from the pharmaceutical company AstraZeneca. We're now joined by Dr. Ashish Jha. He's Dean of Brown University School of Public Health. Dr. Jha, good to see you this morning. Let's talk about the latest news from AstraZeneca, which they say has a 70% effectiveness. Now, that sounds good until you hear about the other two that have a 95% effectiveness. Tell us why experts are excited about this one.
Yeah, good morning, Gail. Thank you for having me on. I think part of it is we got a little spoiled, right? I mean, a couple of weeks ago, I would have said 70% is a home run. Right. 95% from the other two has really raised the bar. But the problem here is that there are two arms of the study, two different dosing regimens. One of them was about 60%, the other one was 90%. We got to sort out what happened in the 60% arm. But I think this is really good news. And I suspect we may get to 90% on this vaccine, too, if we get the dosing right.
Now, scientists are telling us that they hope to have this vaccine available to some by December 11th. Does that timeline make sense for you when we're looking at all the drugs that are potentially available?
It does. I mean, look, we are, obviously we've been stockpiling a lot of these vaccines. They've got to go through approval. The data's got to be reviewed carefully. But I think given the urgency of the time we are in, there's no reason to think we can't get that that timeline done for approval by December 11th.
Let's talk about Thanksgiving, because we keep talking about it. The experts keep saying, cancel your plans, don't go. I'm not going to see my kids for the first time in over a gazillion years, which is very upsetting, but that's how it goes. So you're telling people, cancel your plans, do not go. Clearly, a lot of people are not listening to you. Sometimes people have to hear it more than once. What is your message as we sit here today?
Yeah, so first of all, absolutely. If you can avoid traveling for Thanksgiving, you absolutely should. I see my family every year. We're not doing it this year. We're staying home. If you have already committed to going, if you've already left, there are things you can do to make it safer, Gail. But there are tough things, like try to eat outside, wear a mask when you're inside with your family. Not things that we're used to doing during Thanksgiving.
But what about this? What
if you're going to eat indoors, yeah.
But Dr. Jha, people are saying this.
Please.
I'm going to take a test. Yep. Everybody in the house is going to take a test. And so we're all going to gather together, and we've all tested negative. Isn't that okay?
I wish it was, and that makes it better. It's better than not testing at all. But we know, like, let's say I was infected yesterday. I could get tested tomorrow. I'd be negative. I could travel on Wednesday, and by Thursday or Friday, I could be contagious, passing it to other people. This is the problem. One negative test does not buy you out of this. So I think if the strategy is testing and then act normal, it's still really risky. If you want to do testing, wearing a mask inside, and keeping windows open to make sure there's good ventilation, like that might, again, make it safer. But this is all risky stuff, and we're so close to a vaccine that I want to make sure that we get through the holidays and keep people safe.
So, Dr. Jha, when you see pictures of all these people at the airports, what do you think all this travel for Thanksgiving ultimately will mean for the Christmas holiday?
Yeah, what I'm worried about is, look, we're already seeing a surge in cases in large parts of the country. After every holiday over the last 6 months, we have seen another surge of cases. I'm worried that what's going to happen is we're going to see a big bump. Hospitals already are strained. They're going to get into more trouble. And by Christmas time, I think we're going to be in a lot of trouble with a lot of infections, a lot of hospitalizations, and a lot of deaths.
Okay, all you can do is put the message out there and let people make their own decisions. Thank you very much, Dr. Jha.